Sarah is currently being considered for a partner faculty position, so partnering between the BC CDC and the School of Population and Public Health, and as part of that process, she is giving this seminar. Sarah is nominally sort of works in the area of health impacts related to climate change. She did her PhD work focused on health impacts of forest fire smoke, and then that was at UBC in SPPH. Did a postdoc in Tasmania on the same topic, and at the BC CDC has continued to work in that area, as well as another impact of climate change, which is hot weather events, which is the topic of discussion today. At the BC CDC, she's an environmental health scientist and works on research, but also on surveillance issues related to foodborne illness outbreaks, and also has very strong methodologic skills in data processing, statistics, geographic information systems, programming, and is generally all around a good person to get to know. So without further ado, I'm going to introduce Sarah's talk, Cause and Effect, the Lower Mainland Hot Weather Event of 2009 and its ongoing implications. So, Sarah.
Thanks for that nice introduction, Mike. I want to start by saying that I've actually been coordinating speakers for this series for the last couple of years. I found myself a very easy speaker to coordinate. So it's actually nice to be up here in front of the room rather than worrying about whether there's any technical issues or all of the other stuff that we worry about on a week-to-week basis as part of the team that organizes this seminar series. So Mike's quite correct. I cover a lot. I am sort of the quantitative point for mental health services. So anything related to quantitative study design, data analysis, I'm the one that covers all of that for everybody, and I offer my expertise out and also pursue some interests of my own. I started the BC CDC in July of 2010. On July the 7th of 2010, and on July the 8th of 2010, my boss came to me and said, Sarah, what temperature should we call heat health emergencies at in the Lower Mainland? And what I'm going to talk to you about today is the answer to that question and everything that kind of came out of it over the past few years. So during July of 2009, the Lower Mainland experienced what was really an unprecedented hot weather event. It has never been that hot in this area on record before. I'm going to tell you about the heat-related mortality that we saw during that period, but what I really want to tell you about is what's come out of that event since I started working at the BC CDC in 2010. And that's really a three-phase interconnected thing where we're going to talk a little bit about epidemiology, we're going to talk a little bit about public health, and we're going to talk a little bit about surveillance. There's a lot of crossover between them. If you're confused about which part of this I think we're talking about at any given time, look down at the bottom of the slide and it's going to tell you we're talking about epidemiology. So I'm not going to give you an overview of what I'm going to talk about. I'm just going to go through and hope that you follow along okay. I'm first going to just tell you a little bit about this event. So, what happened during this 7-day period? This is a map that comes to me from a colleague at SFU, Anders Nudby, who is collaborating with us to try to generate maps of what the really fine spatial scale of hot weather is in the Lower Mainland during these hot weather events. So even though it might register 31 degrees at the airport, it might well be 34, 36, or 38 degrees at your house. But because Environment Canada didn't put a weather station at your house, we don't actually know that. So this is kind of a risk communication tool that if it says 31 degrees at Vancouver, this is probably what it looks like across the city. We're not at the air temperature stages of this yet. The best information that we have available is remote sensing data, and that can really only tell us surface temperatures. So what Anders and his students are working on is making this connection between surface temperature and air temperature, and it's not directly linear like you think it might be. So I've got two areas circled on this map. Down in the east out there, that's Abbotsford Airport. So you hear me talking about temperatures at Abbotsford Airport quite a lot. And you can see that's hot. There's a lot of tarmac. It's inland, and it gets pretty hot during these events. Maximum temperatures measured at Abbotsford during this hot weather period were about 39 degrees. And then we have Vancouver Airport. You'll hear me talking about that quite a lot too with respect to Environment Canada data, and that's because the best temperature data we get from Environment Canada for this region comes from those two airports. And you can see, even though it's got all the same sort of tarmac and what have you, it's less hot there, and that's really a question of the coastal influence on the temperature. So that's what we're looking at temperature-wise. Now, probably the most famous at this point heat wave / hot weather event in history is the one that hit Europe during the summer of 2003. This is a plot of deaths in Paris over that time. That heat wave has been associated, estimates, in tens of thousands to hundreds of thousands of deaths. That's not what happened in the Lower Mainland, but there are similarities between the two that are interesting to note. So the top dotted line shows you the maximum daily temperatures during this period. And what you can see is the heat sort of starts to go up around here, and the corresponding increase in mortality happens a couple of days later. And that's very typical of these situations where you really need the heat to build in the atmosphere before it gets so hot that people run into trouble with it. We very rarely see that one-off hot weather events are associated with mortality. It's really these waves of hot weather days. Another interesting thing to note about Paris is that black line at the bottom is the minimum temperature, and you will often see that the minimum temperature, so how cool it got at night, is more associated with hot weather mortality than the maximum temperature. That's not actually true in the Lower Mainland. We don't see that relationship, and again, this is probably a question of that coastal influence. So this is what happened in the Lower Mainland during the summer of 2009. It's not nearly as impressive, but the same sort of thing. The temperature starts to go up, and then the mortality starts to go up. We have estimated that this particular event was associated with approximately 110 excess deaths. There's a confidence interval around that. That doesn't sound like a lot when you're comparing to 10,000 excess deaths, I understand. But to put this in the context of another public health question for you, consider the H1N1 pandemic that happened a few months after this. The estimated number of deaths in all of British Columbia attributable to that pandemic is probably about 70. So, we're looking at a lot of people who died because of an exposure, and then for a second think, okay, what would have happened if we crammed all of these if there had been 110 H1N1 deaths over a 7-day period in Vancouver? If you think of the media attention that pandemic got, how would that have looked in the media? It would have been insane. And there was really no insanity around this. It went by very quietly, and that's another kind of hallmark of these hot weather cases. They tend to go by, and then people pick them up at a later time. Finally, this is just a look at changes in mortality across the region. I'm going to be talking to you a lot about local health areas, which is the smallest of the health geographies we use in British Columbia. I have them delineated here for you to better see. And you can see that most of the shift in mortality here happened in the Vancouver area, some in New West, some in Surrey. So it seemed that population was a little more sensitive, but we're going to break this out in a better spatial way later on. So first question related to epidemiology. Were the people who died during the hot weather event different from people who died at other times? And this is a key question. Are there specific populations that we need to be targeting in future when we expect this to happen again to prevent this kind of excess mortality from happening? To look at this question, what we did was we broke the summer of 2009 into 3 different periods. First of all, we have this hot weather period. We defined as 7 days. We took 7 days because there can be a day of week effect related to mortality in the vital statistics data. We took the 7 days with the maximum running 7-day average, so we defined what was the hottest week of that year. We looked at the 8 previous weeks of that summer. We don't want to look back too much because, the population is changing, and we're not using really rigorous epidemiologic methods here, so we want to compare something within the same time period so we don't have to account for those population changes over time. And then we took a very special 10-day period in June, and I'm calling this the neutral weather period. And what I mean by that is that when we consider the overall relationship between temperature and mortality, what we see is people die more in cold weather. It comes down to some sort of minimum mortality, and then it starts going up again as the weather gets warmer. And that minimum mortality range in Vancouver is when we're looking at maximum temperatures between 16 and 20 degrees. So this 10-day period had maximum temperatures in that neutral mortality range, and also a very similar number of deaths to those 7 days later in the summer. So 7 days and 10 days, but a similar number of deaths. So the first thing we question is, okay, let's take a look at the underlying cause of death for these individuals. Were there any differences there? What we see is that 1% of people during the hot weather period died with a ICD-10 code, International Classification of Diseases code, related to extreme heat. So we know that approximately 110 of those people died because it was hot outside, so we can't use this as a good indicator of who died during the hot weather. It gave us one person. A little bit of shift upwards in respiratory mortality. That's not uncommon during these periods, not statistically significant in this case. A little bit of shift downwards in cardiovascular. We also looked at lung cancer because we thought that might be something that was affected. It really wasn't. And we also looked at psychiatric codes because we thought, based on sort of knowledge, that might show up. It's definitely the case that you often see people with mental illness affected by the heat during these periods, and the fact that we didn't see that in the coding doesn't necessarily make it untrue. The susceptibility of people with mental illness may well be a factor related to the medications used to control those illnesses, or it may be an aspect of the mental illness itself. That's really not clear at this point. So using the limited administrative data that we have available to us, which is our individual level mortality records from the vital statistics data that the BC CDC receives on a day-by-day basis, we tried to do this really sort of quick and dirty analysis where we look at various characteristics of people, and then we look at their odds of dying during the hot weather compared with the two comparison periods. So, this is the very basic model that we're using down here. What we find is that a difference in people aged 64 to 75. So you had a 50% increased odds of dying in the heat if you were 65 to 74 compared to being over 85. And we're not looking at huge numbers here, but that was a significant difference, and that was consistent over the two periods. No real difference between male and female. Another big difference is with respect to where you actually passed away. So one of the things we know from the vital statistics data is whether you died in hospital or a long-term care facility, in your home, or in some other specified location. So here we're looking at home and other unspecified location compared with dying in some sort of care environment. And we see, again, people are passing away at home or in other places. And that probably reflects the fact that once you get into trouble with the heat, it's a very rapid downhill progression. You might not have time to make it into care. Another thing we were interested in was the question of population density. We know there's this urban heat island effect where more built-up environments retain more heat. And like I said at the beginning, when we first started this work, all we had was the local health area of residence. when the person died. So that's pretty coarse scale for addressing a question like this, but that's what we had and that's what we used. And even when we split it out that way, in a very crude kind of way, we can see that population density is having some sort of effect. The number of seniors living alone, not so much. And then another big one, the percentage of the population under the low income cutoff. So we're seeing populations with more people under that cutoff being more affected. And again, you know, this was quick and dirty. This was just a question of what can we do with the data available really quickly to assess this problem. Recently published in the American Journal of Public Health. Based on that information, I was able to go to Vital Statistics and say, the feed that you guys give us is great. We're finding it limited to address questions of environmental problems because of this spatial aspect. You know, the environment is hugely variable across space, and we don't have the corresponding information available to us from this feed. Would you be willing to add the 6-digit postal code of residence to our data feed? This is the fastest thing that has ever happened to me administratively at the BC CDC. Within a month, we had that information appended, and we were able to actually plot things out in a different sort of way. I'm sorry these colors aren't showing up particularly well on here, but what we're now able to do is say, okay, we can get a much better idea of where these people were in space. So what we've got here is the 397 people who died during the neutral weather period, compared with the 399 who died, or sorry, the 397 who died during the hot weather period, and then the 399 during the neutral weather period. And what you can see is they all sort of extend across all of space. There's nothing very interesting in this particular plot. When we take that information and we combine it with other spatial sources of information, things get a little bit more interesting. So one of the sources we used was the Vancouver Deprivation Index. There's lots of different deprivation indices. They're all built from census data at the census dissemination area level. This one's a little bit different because the researchers behind it actually went out into the field and asked all of the medical health officers in the Lower Mainland region to take these variables measured in the census and to rank them in order of how strongly they felt they were associated with people's health. They took those 18 sets of rankings and built a deprivation index based around actually health specific to this area. So pretty interesting work. And then before we started working with Anders, we didn't have that question of temperature across the area sorted out, but we used something that's kind of a good proxy for it, which is the amount of greenness. This is pretty easy to get from remote sensing data, and what it measures is just how much greenness is around an area, and that's sort of inversely associated with temperature. So the more trees you've got growing around your house, the cooler it tends to be. So again, a proxy measure, but a useful one. This is a very simple way to look at changes between these two populations in the hot weather and neutral weather period. Remember that we're looking at a different number of days of deaths, but what we see is that shift from the lower deprivation, where most older people, by the time they pass away, they're in the lower deprivation indices, and down in towards the high deprivation. So this is consistent with what we were seeing with respect to the low income cutoff. There's definitely a skew in who was affected here. And then when we take that and match it up with that greenness index, and we look, you can see as deprivation increases, greenness decreases. People with more money live in greener areas. That's not necessarily surprising. When we get down to the highest deprivation, we see there's quite a difference with respect to greenness in those high deprivation hot weather deaths. So not only was it a more deprived population, it was a more deprived population living in hot weather, in hotter places. Last week, I got a third email from CIHR saying, no, we're not going to fund your study. which has been very depressing for me because I think it is a good study and it asks a lot of questions that really need to be addressed. We've come to the conclusion that CIHR really just isn't the right body, and we'll approach Health Canada with this work instead. We want to look much closer into this question of deprivation. Of course, what we've done so far is very crude, but it's enough of an indicator that we should take this question forward. That question of pharmaceuticals that I brought up earlier, we can address that by linking these with the PharmaNet database. We would like to do that. The question of comorbidities, are people with diabetes more or less affected by the heat? We don't know. We would like to address that by linking with the MSP database. And then the question of housing characteristics. Did your house have air conditioning? Was it 3 stories or 1 story? Are these questions important? And that's something that we could look at with linkage to the spatial property assessment database. So we have data to address these questions. We don't have money to do it. It kind of doesn't matter. That's research that we would like to do. It would certainly help us to better address these questions in future. Regardless, we have enough to move forward with when it comes to the question of public health protection. We don't need more research. We do know that we need to do things to try to protect the population during future such events. So here's that question my boss asked me. When should we call a heat health emergency for the Lower Mainland? Seems kind of simple. It's not. So this is a very typical way to model the relationship between temperature and mortality. We take a really flexible kind of model. We say, okay, let the temperature effects have a lot of degrees of freedom. Show me what this curve looks like. Is it smooth? Is it lumpy? It usually comes out looking pretty smooth like this. Here, again, you can see this minimum mortality area that I was talking about. And, you know, this gives us a pretty good indication that, yeah, the population does respond in the heat. More people die. What it doesn't do is provide clear insight into what's dangerously hot weather. You know, do we make a priori decision that 20% increase in mortality is unacceptable? That's where we're going to call it? Well, if we do, that would happen around 28 degrees. Why not 25%? Why not 23%? It doesn't give you any indication of where we should draw that line. It's also a question of what temperatures you use when you build this model. This is the 2-day average of maximum temperatures from Vancouver Airport. If we build this model with temperatures from Abbotsford Airport, it looks quite a bit different. It's a lot flatter. You know, there's not a clear way to do this. So what we really came up with in looking at this was, okay, it's not the smooth curve that we're interested in. It's really what the data are doing underneath that smooth curve. How they're jumping around. Are there clear steps where we could draw a more solid line? So when we place that smooth curve over box plots of mortality at these temperatures from 2005 to 2009, what we see is, yes, there does seem to be an indicator of a clearer break there around 30 degrees. This is where we move forward from. I should say that this sort of process in other places has been very complex. A lot of areas with hot weather emergency warning systems will use synoptic weather models, and they'll say, okay, these synoptic types of systems are associated with high mortality in our area. Not only are those things challenging to build and to interpret, it's also not really appropriate for Vancouver because we have sort of one type of weather system that's associated with these hot weather events. And just because we have that weather system in town doesn't mean we're going to have a hot weather event. So we needed something sort of a little more clear cut than that bigger way of approaching the problem. So what we did is took a really data-driven approach. We said, okay, let's call the 99th percentile of mortality over this 5-year period in the summer extreme. And let's call the 99th percentile of 2-day average temperatures over this period extreme. And let's look at it based on temperatures from the Vancouver airport and from the Abbotsford airport, because we do have these 2 different good sources of information, and they might be a little bit of difference between them. And when we do that, and we take the intersections of these extremes, we see that 58 or more people died. 58 was the 99th percentile at temperatures greater than, at 2-day average temperatures greater than 31 at Vancouver Airport, or at 2-day average temperatures greater than 36 at Abbotsford Airport. So I need to be clear here that we're talking, in both of these plots, we're talking about the same deaths. It's the same time series of mortality. Here we're expressing it related to temperatures in Vancouver, and here we're expressing it related to temperatures in Abbotsford. And you can see how different those temperature series play out. But that's the indicator that we're looking for, that we're into dangerously hot weather. So, great. Except that you don't know those conditions have passed until they have passed. Emergency responders, if they're going to respond, need a little more time than, oh yeah, today was a heat health emergency, we should have done something about it. So we need to develop a system that can, as accurately as possible, predict these conditions based on the data available. We don't want a lot of false positives. We don't want to be crying wolf here. This is a huge effort to ramp up when it happens, and we don't want the population not to believe us, and we don't want the emergency responders not to believe us. So we have to nail this most of the time. On the other hand, we do need all the true positives. We can't miss hot weather days. That's not cool. We want to pick up all of these things that happen. So what we do is we take the last 5 years of data to see if we can reliably predict those conditions. What data do we have available? Oh, naive me. I thought I'd be able to walk into Environment Canada and say, well, you must have a record of all the forecasts that you've issued somewhere in a database, right? Like, yeah, we've got them in text files. So they don't actually keep this information in nice linear way at Environment Canada, but they do have these text files. There are 3 official forecasts from Environment Canada daily, one at 5 o'clock in the morning, one at 11 o'clock in the morning, and one at 5 o'clock in the evening. And this is what it looks like. So not only do we have the data, now I have to write some code to parse out the information from these text files that I need. The text files change from year to year. They're formatting and everything. Very challenging. We eventually did it. It took me about a month. And this is what we're looking for. Okay, here's the 11 a.m. for today. Today's high is going to be 17. Oh, and there's tomorrow. Tomorrow's high is going to be 19. This is the information that I want from that. And this is the table that I'm trying to build. So from the 5 o'clock in the morning forecast, I know what the estimated high for today is and what the estimated high for tomorrow is going to be. From the 11 o'clock forecast, I also know those things. And then there's this question of, okay, we know today's high probably isn't going to happen somewhere between 4 and 6 p.m. That's a little too late. So is there another earlier temperature in the day that's highly correlated with today's high? We looked at everything, and unfortunately that relationship doesn't even stabilize till 2 o'clock. The 1 o'clock p.m. temperature is not indicative of what today's high is going to be. The 2 o'clock temperature is. So okay, we have that useful piece of information. And then from the 5 o'clock forecast, they're not going to estimate today's high because it's probably at today's high, but they're still estimating tomorrow's high. It might be a better estimate than the 11 o'clock forecast because they have more information. And then again, this actual observed high from today comes in here. So if we combine the 2 estimated highs, we could have a 28-hour lead time on a heat health emergency. That would be awesome. Even if we combine the 11 a.m. forecast highs, we could have a 22-hour lead time. That would be awesome too. Next, we have the option of combining these 2 things. That's a 19-hour lead time. That's cutting it a little close. And if we combine these 2 things, we have a 16-hour lead time. So we would be telling people at the end of the business day, hey, tomorrow's an emergency. Hope you don't mind. Which is not something that our stakeholders in this project really did not want to have happen. So when we combine everything all together and we're trying to predict those indicators, we already talked about 31 in Vancouver, 36 in Abbotsford. You can see that we're looking for 4 true positives At the 16-hour lead time, we've got 2 of them. So that's not acceptable. Okay, what happens if we drop what we're trying to predict down by a degree in both cases? Here at the 16-hour lead time, we've got all 4 of our true positives. Great, right at the end of the business day. That's not really acceptable either. So we drop it down again. So now we're trying to predict 29 and 34. And you can see we have 4 cases where we've actually got all of our true positives. And we don't have too many false positives in any of these cases. We got 6, 3, and 4. When we brought this to all of the stakeholders, which are all of the municipality emergency responders and the health authority emergency responders, they said, we want this one. We don't want 6 false positives over the course of a 5-year period. That's unacceptable to us to capture those 4 true positives. We want to minimize the false positives and have less lead time. So great. We came to the decision they wanted, and that's what we're aiming for. So the final recommendation is a heat health emergency should be called 19 hours in advance for the entire Lower Mainland when the average of today's 2 o'clock measured temperature and tomorrow's forecast high equals or exceeds 34 degrees at Abbotsford Airport, 29 degrees at Vancouver Airport. The emergency should be sustained for as long as either criterion persists. So every day at 2 o'clock, my computer goes to the Environment Canada website, grabs the 2 o'clock temperature for both of these airports, and also the estimated temperature, the forecast temperature, which is also reported on the Environment Canada website, combines them, tests whether or not these conditions have been met. Regardless of whether the conditions have been met, it sends around an email to all of the stakeholders that says, here's what things look like today. When the conditions have been met, it sends around another email that says, the conditions have been met, and we need to have an emergency phone call at 2:15. That hasn't happened yet. So this system has been up and running through the summers of 2011 and 2012. We have not met the emergency conditions. Oh, I had another slide here, I'm sorry. When we have that phone call, so it's between a bunch of stakeholders and Environment Canada, Environment Canada is going to say, you know, the way the weather's looking, we expect things are going to cool off, or they're going to say, no, it's going to stay hot. You need to put the emergency into action. When that happens, there's an entire flow chart. This thing is huge. I look at it, I get so confused about what's going to happen in all of the municipalities and across the health authorities. But it's pretty basic stuff, like the health authorities touching bases with all of their care homes to ensure that emergency cooling is in place, making access to swimming pools free in a lot of the municipalities, trying to keep malls and other large air-conditioned places open so that people have a place to cool down for free. And it's a huge chain of response. So like I said earlier, we don't want false positives. They're a big deal. So hasn't triggered in the last 2 summers. A natural question as well, is it working? And this is something that we are always evaluating in real time. Is the system working? Are we doing this right? Are we on top of what's happening here? So this is just a sample of the type of vital statistics data we have available to us at the BC CDC. It's all scrambled up, but it's just to show you what's there and what happens. Every weekday morning, this is updated quite early in the morning, and so for January the 14th, how am I going to put this? Okay, so here we have a death date of January the 14th, and also the death was registered on January the 14th. This is actually pretty rare. What normally happens is you die, and then the administrative process of registering your death takes place over the course of the next few days. So we don't see a lot of deaths that happened yesterday also registered yesterday. In fact, there's only 2 here. And then we have the January 13th deaths, and a couple of more of those were registered on the 14th, and it goes down and down. The only thing we know about your death the day after it happened is that it happened, how old you were, what your sex was. We don't know anything about the underlying cause of death. That gets populated at a later time by a different process. We don't know where you were when you died. That gets populated at another time under a different process. What I haven't included here is we do know your postal code. So we can get a sense of where you were in space when you died, if you died yesterday. this is what those data look like over time. So here we have the day 1, I'm going to call it, through to the day 14. By day 14, we expect the data for all intents and purposes to be complete. There might be changes down the line, but you can see in this particular case, things started to stabilize around day 8, and it will probably remain at 44 deaths per that day. What to note here is, A, we don't get this information on weekends, so we're jumping from Friday to Monday, which is an important point, and B, on day 1, 1s and 0s are pretty common, 2 is less common, and I will tell you from my experience of the last 3 years, 3 is rare. So that's unusual, and we're going to talk about August the 16th a little more in a second. So what we've developed since the summer of 2010 with these data is something that's generally referred to as nowcasting. The question being, all right, based on the information that we have available to us today on day 1, what's day 14 going to look like for today? How can we predict how many deaths we will have had on this day by the time day 14 shows up? Day 14 is too late to be addressing this question, so we're trying to do the best we can with day 1. And when we initially developed these models, what we found is that the relationship between what will happen on day 14 is with what we saw for today, what we saw for the first day, on the first day of the last available day. So that would be a Thursday if we're talking about a Friday. It would be a Monday. No, right? If today is Friday, what happened on Thursday? If today is Monday, what happened last Friday? So we have to account for that jump in our data. And on the day 2 of that last day, and then the day of the week in both cases. That was, when we originally ran this, the best model we could come up with. I haven't revisited this model since early this summer, so I haven't updated it with the information we've collected this summer. The important thing to know about this is that we were not collecting information to allow us to do this when the actual hot weather event of 2009 happened. So we don't have that historical precedent built into this model, and therefore I'm not convinced that model performance is as good as it could be, but the more data that we get, the better we expect the model to perform. So we update the coefficients of this model on every summer day and apply it. Summer days only, because mortality in summertime looks different from mortality in wintertime. We're not trying to pick up flu epidemics here. We are trying to look at hot weather. So there's 2 conditions under which our every morning data analysis is going to send an alert to me and to my boss, Tom, and that's if our model estimates more than 54 deaths. That is on day 14. That has never happened so far. We did reach 52 one day this summer, and I'll tell you about that in a second. And if we see that magical number of 3. So that really sort of unusual case where 3 deaths from yesterday were already registered yesterday. That's happened once in the entire time that we've seen this. And again, that was the August the 8th of 2012. So August the 8th of 2012. This is, I'm sorry, I didn't create a very nice plot for you here. This is a surveillance plot that gets generated every day. I don't actually have the data to go back and recreate it. So we're stuck with what we have available. On this particular day, the temperature checks for the day before had been 28.4 degrees in Vancouver and 33.2 degrees in Abbotsford. So we're coming very close to those temperature trigger conditions. At the same time, my algorithm sent me and Tom an email in the morning that said, hey, we've already registered 3 deaths for yesterday. That's weird. So what we decided to do was in the morning when that happened to trigger that emergency call at 2:15, regardless of what the temperature information actually said. We felt we had enough other evidence beyond the temperature information to move forward with a rationed conversation about the situation in the city. And as it turned out, the temperature checks for this particular day were somewhat lower. We all got on the phone at 2:15, and David Jones from Environment Canada said, it's cooling down, it's cooling down. I don't see the need for an emergency call out, and we did not trigger one. What this plot shows us is that really, in the scheme of things, we made the right decision. So you can see we've got some hot weather. This is actually, these are mean temperatures, so it actually, the maximum temperatures got hotter during this period, but we're stuck with mean temperatures here. And this is the date that we're talking about. So the 16th is in here, this day. And what we see is we're at 50 or 51 deaths. We're not in that sort of extreme range of mortality. There's definitely been a little bit of an uptick, but not what we could consider to be indicative of a catastrophic mortality event. And as far as we're concerned, we made the right decision. We did not trigger what would have been a false positive in this case. And then I was telling you about that day where we estimated 52 deaths, and that was actually this day here. And this might well be related to hot weather in that it was sort of the first really hot weather we got this summer. I don't know if people remember how wretched June and July were, but it didn't get hot until August, and you often see a bigger response in the first hot weather that happened. So it might be related to that, it might be related to something else. There's a lot of noise in these data, as you can see. So the other stuff that I've told you about so far, we have published to make available. We haven't published this information around the surveillance and the nowcasting. And that's partially because we don't feel like we have enough data behind it yet. We've really only been generating these data since 2010. We haven't had hot summers in BC since then. Until we have a really hot weather event, and we're hoping we don't for a while, we're not in a situation to really test the system. But what we feel so far is that it has not failed. And that's pretty good from where we're standing. The BC CDC had an accreditation review in 2011, and we sat down and talked to the accreditors about this work, and it was one of the two things currently happening at the BC CDC that was recognized as a leading public health practice in Canada, meaning something that other public health agencies should think about emulating. So we're pretty proud of that. So I've been at the BC CDC for 2.5 years now. I would say I've learned about 3 times as much as I did in 6 years of a PhD. It's been constant on-the-job learning. It's been fantastic. I had no background really in heat health before I started working on this stuff, and now I feel like I have a lot of experience in it. And I always tell people that at my very heart, I'm a problem solver and a jack of all trades. You throw me a problem, and I will find the tools to solve it. And I feel like the BC CDC is the perfect fit for me in this regard because we get these problems, and it's just such a joy and such a pleasure to try to figure out methods that we can use to solve them within the resource constraints, within the human resource constraints. And I think we've built something pretty good here out of not a lot to work with. So you can always contact me here, and I'm very open to taking any questions right now.
Wow, Sarah. Every time I hear you talk about this, I just think it's so fantastic. And I'm so glad that you guys got an award for it. And it really drives the question that I was thinking of before you mentioned that, which is this going to be rolled out for all of BC? And what about moving it across the country, especially to some of the areas that have more frequent hot weather events?
Right. So Kay's question, did the online listeners get that? Okay. So in some ways, this is very local in that I don't think the kind of system that we've developed here with respect to the alerting anyhow would be appropriate for other places like Toronto, where they have different weather systems that are associated. You know, when it gets hot in a place like Toronto, it's usually quite humid as well. That's not true here. It's usually dry. So I don't think our alerting system would be appropriate for them. And for the most part, they have their own alerting systems in place. Where I do think we can really contribute more widely to what's happening in other places is this question of the constant real-time surveillance of what's happening and how well our system, our alerting system, or how consistent our alerting system is with what's actually happening in the population. And I know that there's a lot of interest in building stuff like that. In Quebec, they're quite far ahead, but I'm not sure of the status nationwide. The question about further rollout to other populations in British Columbia, we have been working quite closely with Victoria, and they will initiate something like this next summer. And the other question for us is we're quite interested in is population response to the heat across the province. We know there's actually very little response to the heat in places like Kelowna and Kamloops, where people are very adjusted to dealing with hot weather. We see very little uptick as things get hotter, but in the north, in Prince George and those northern regions where they're really not accustomed to it, that's actually the most sensitive population in British Columbia to these hot weather events. So there's definitely room for expansion.
Sarah, what happens to mortality after these events? I mean, I'm trying to get the sense as to whether this is overall excess mortality or really accelerated mortality of people who, were pretty frail and likely to, leave us in following 6 to 12 months.
And that seems to differ. We see no evidence of this being sort of a harvesting effect. There was no drop in usual mortality after this event in 2009. In some places, Paris being one of them, where the mortality really did occur in the more elderly, they do see that drop, but we didn't see it here. So again, that seems to be a bit more place specific, and it's not to say that the next time that wouldn't happen, but around this one single unprecedented event, we did not see that.
So thanks, Sarah. Really nice talk. 2 questions on the sort of surveillance part of this. I'm wondering a little bit about sort of latency and cumulative effects. So usually when you have heat events, it's not sort of, one day. It sort of builds up over 3 or 4 or 5 days. And if you're calling an emergency on the 4th day or the 5th day, there's probably some people who have already been exposed. And if you've thought about building that at all into this, the other sort of related aspect is there's a lot of work on sort of surveillance using social media or Google searches, and just as another source of information, when people are concerned, using that as something to also help trigger.
Right. So the question of latency is something we talked about long and hard. And really, again, this is something we put to the stakeholders where they said, we're kind of willing to accept one hot day going by before we call it. Like I pointed out earlier, a single hot day in this region really doesn't have a mortality impact. And these days upon days of hot days are pretty unusual. So the feeling was that there would be the opportunity for too many false positives if we were trying to look for a single hot day. So that was a decision that was consciously made, and it's something we have talked about, trying to see if we can detect these hot weather systems earlier, and that's really where we're partnering with Environment Canada on this. So they're developing better alerting within their weather monitoring to say, okay, we've got a hot period coming up, and that feedback into the public health community. The question of social media is an excellent one, and it was one I was thinking about this summer because as it got hotter during this period, we get a lot of calls to talk to the media about the heat. And whether or not we could build that into the surveillance isn't something that I've considered, but I know that they do it for flu and what have you, so there's no reason why we couldn't pick up on some of those methods and apply them to the problem that we have here.
One online question from Paul, and he says one of the anomalies of the heat advisory system is that different temperatures trigger actions in different areas. In BC, we do not have clearly defined media areas, and so what's an advisory in Vancouver is a nice day in the Okanagan. And the conflicting message causes some grief. Have you explored the communication issues and in particular the unintended consequences of inappropriate messaging in other areas?
No? No, this is quite true. One thing I do want to be clear about is we call a hot weather emergency for the entire Lower Mainland area. So even though we're using information from Vancouver and or Abbotsford Airport, it is a region-wide call. It actually stretches up to Whistler. It's a fairly well-defined area that's covered by this. The fact that we're calling a hot weather emergency in Vancouver, but the folks in the Okanagan think it's a pretty nice summer day, is not something we've really addressed. And I do understand, especially in a huge province like BC that has not too much local media, but more sort of provincial media, I do understand that there's a lot of room for confusion around something like that. And as we introduce another system in Victoria, you know, a hot weather emergency in Victoria, but not in Vancouver, what does that mean? And I think those are communications questions that are just going to have to get hammered out as these things occur, or preferably never get hammered out because these things never occur.
I spent my first 16 years in Calgary and a couple of years in Lethbridge, and like people are saying here, the temperatures there are probably even a wider range than what you see in the Okanagan. I'm wondering, does that affect life expectancy there? Or, you know, the fact that people there have to cope with an 80-degree temperature range between summer and winter every year, as opposed to the much narrower range we live in here?
I should know the answer to this because I think there is evidence around this, but I can't bring it to mind. I do believe that there is an association with life expectancy. So the variability in temperature in the place where you live is associated with your life expectancy, but what I can't recall is whether or not it's a positive or negative association. I think it might, like the more variable it is, the longer your life expectancy, but don't quote me on that because I really can't bring it to mind right now. But there is evidence around this.
It was quite an incredible presentation. Sarah, very, very interesting. I was hoping you just clarify something for me. I might have missed it. You said that it's a bit unusual to have deaths registered on the same day as the death, but that was used as a predictor in your alert system. I think it was the day before. Deaths registered on the same day.
If we're talking about Friday, deaths that occurred on Thursday and were registered on Thursday.
Okay. And so what causes deaths to be registered on the same day? Is it just people were more diligent, you know, with the administration? Is it actually related to the heat event?
No, this is a process I don't actually understand probably as well as I should. We do know that those 3 deaths that happened based on the postal codes associated with them, all 3 were from long-term care facilities. So it might be that those facilities just have sort of a quick method of getting the death registered. I'm not really sure. Sometimes you'll see these were all non-accidental mortality, so we're not considering drownings and car accidents and all of that stuff, but sometimes you will see that those deaths get registered quite quickly as well. But the drivers of time to registration is not something I'm really familiar with, and I should be. But good question.
Thanks, Sarah. So this was a lovely example of kind of using data for environmental health surveillance. I'm just interested in what else you might be applying this model to as part of your collaborating center, or what other issues you might be on the forefront of that you could apply this to?
So we are exploring lots of different places where there's a role for surveillance in what we do. And one of the things about environmental exposures is that they do sort of happen over very rapid periods. So we do need rapid information about them. We've built a system a little bit similar to this, but not using mortality data in this case, but using dispensations of medications to control asthma. and that's specific to forest fire smoke events. So, you know, if we have a really bad fire summer in British Columbia, there's places that just get hammered with smoke, and lots of people are healthy enough to withstand that, but it really does seem to get to people with asthma. So we need to be able to tell our health officers in the field that, you know, your population over here is responding. So we are, this week we had a pilot system up and running with those data. It was a week behind, and we're just now working with PharmaNet to get those data in the same sort of real-time way that we get them for the mortality data, so that on a day-by-day basis during fire events, we can say, whoa, things are looking weird in the Okanagan, or things are looking weird up north. And that gives the environmental health officers a little more information about how they need to act. So that's one other place. I would say the other place where we're making the most progress right now is Environmental Health Services at the BC CDC is now home to DPIC, the Drug and Poison Information Center. And as of 2010, DPIC established a new digital database. They'd been keeping all records on paper before that. So we're now looking at developing things around carbon monoxide poisonings. And ecstasy has been a big interest recently, since there have been so many ecstasy deaths in the province. So there's lots of things in the works, but I would say this is the most developed of them so far.
Just I've got a follow-on question from Mika. Has any study been done on the effectiveness of, say, an N95 respirator against forest fire smoke? And you know, advising asthmatics to try respiratory protection?
It's actually, we're building an evidence review around public health interventions for forest fire smoke right now, and that's one of the questions to be addressed on the review. I'm not really up to date on what the answers to that might be. It's not an area where, I mean, forest fire smoke is an area where I have a lot of expertise. The actual intervention of a mask is not. I know there's been concerns expressed in the past that wearing a mask actually makes it more difficult to breathe. So there might be a trade-off there, but I'm not sure, and it's probably something we'll ask you to help us with, Ed.
That was fantastic, very interesting. Sarah, I had a question. Apart from Toronto, where I lived for 16 years, and I think the temperatures here pale by comparison to any Torontonian, about that mortality in the oldest elderly.
Yes.
Where you didn't actually have a significant increase. Is that because, or do you, I don't know whether you know or whether you speculate, is a larger proportion of those age groups in sort of accommodation like residential care, for example, that maybe better temperature regulated,
yeah, so
rather than younger elderly who did experience the high?
You've nailed that nail on the head, Monica. One of the things about, one of the key differences between Paris and a place like here is a lot of the very elderly were living in their own apartments and still caring for themselves. And here we don't see that so much. The very elderly are more likely to be in some sort of cared for environment, either with their families or in a long-term care facility. And what we actually see is they're kind of protected against the heat, because people pay a lot of attention to them in hospital and in care environments when these hot weather events occur. And there's also legislation or bylaws in place that the care environments must have air conditioning, and that's the #1 protective factor in hot weather, is whether or not you can be in a cool indoor environment. So that's likely why we did see a slight increase in that group, but not a statistically significant increase. Good?
Get in. Thank you very much, Sarah, for an excellent presentation and some excellent work you're doing at BC CDC.
Thank you very much.